think therapy is also a lot about pain and a lot about openness towards the darkness and to what we are ashamed about or shamed for, and very dark feelings, a lot of pain. I don't know. And it seems like when you, sometimes it feels, and not with everyone, of course, etc. But in the focusing community, it's a lot about feeling good or going to a good place.
Yes.
Yeah, I don't know. But I feel like maybe I'm making now a caricature of our focusing community.
Well, there is something in the community, in my experience, that is a little bit like what you're describing. There is an, I don't know if it's an expectation, or maybe it's even a little more than that. Kind of that if you're doing focusing well, it takes you to a positive, better place. And if you're not finding that better place, then somehow you're doing it wrong.
Yes, exactly. Exactly. Like you made a, like, or you don't know how to focus.
Yeah. Yeah, exactly.
Yes.
But I think maybe this is partly the point you're making is, if we acknowledge the much more difficult aspects of life, things that we have maybe been hiding from ourselves, not wanting to admit, it's not that it's something that we are glad is true, but there is something in the facing the reality that is a relief. It can feel good to finally admit, I'm ashamed of that. I'm ashamed I did that. There can be a bodily release that actually feels life affirming, even though the content sounds depressing or difficult or negative.
Yes. Yes. I think that's the point where feeling good or not feeling good like disappears,
Yeah,
right?
exactly.
Because
Yeah.
then we're not talking about like what is a good outcome or whatever.
Yeah.
It's an openness towards our humanity,
Yeah.
and to the ambivalence of life, I think,
Yes.
and
Yeah.
all the ambivalent feelings, which actually, I think, create a very different way of maybe experiencing life. It broadens, I think, our scope,
Yeah.
and the problems we are facing
It's
and our
more
challenges.
inclusive in some way.
Yes,
Yeah.
yes, yes.